Public health for the future of humanity. One planet, one people, one health.
When a group of health professionals from China arrived at Malpensa Airport in northern Italy on the 18th of March to share their experience and learning in tackling COVID-19, they unfurled a banner.
Siamo onde dello stesso mare, fogli dello stesso albero, fiori dello stesso giardino.
Public health professionals around the world have been united, working in solidarity for the common goods and betterment of humankind, leading the scientific analysis and advice to decision makers, and on front lines in the field practically tackling the COVID-19 global public health emergency. People have gone to their balconies and front doors to applaud and convey their admiration and thanks for their work and other health professionals in these extraordinary times.
The 16th World Congress on Public Health is held from the 12th to the 16th of October 2020 as a fully online conference. The theme of the Congress is Public Health for the Future of Humanity, Analysis, Advocacy and Action. This is even more relevant now than ever before.
The individual, community, and institutions of society are key protagonists and chief stewards of health, from whose values and interactions the future emerges. When the global pandemic was declared, the World Health Organization, in collaboration with the Global Research Collaboration for Infectious Disease Preparedness and Response, GLOPID-R, organized a global forum on research and innovation for COVID-19, Global Research Forum. The WHO Global R COVID-19 Global Research and Innovation Forum highlighted some key values in addressing the global pandemic, namely solidarity, equity, trust, autonomy, equal moral respect, and vulnerability.
Ethical principles such as this are not intended for abstract philosophical debate, but have significant implications for policy, research, and practice at this time. There is a demand for ethical global leadership to consider and address health inequity and to use the learning and experience from the global COVID-19 pandemic to build a just, healthier, and peaceful world.
Public health is the work, art, and science of preventing disease, prolonging life, and promoting health through the organized efforts of society. At this time, there is urgent need to reconsider the organized efforts of society and role of individuals, communities, and institutions which they serve.
What this global pandemic and other public health emergencies, such as climate change, clearly demonstrate is recognition of the interdependence and interconnectedness of people all over the world and their environments, and the need for unity, not only to overcome this common threat, but also for building a healthy, peaceful future for all humanity.
Global cooperation and coordination during a pandemic outbreak can be considered both an epidemiological imperative and a moral duty, and the way we lead to live and work together in the future.
Such a world will need to address the scandalous social and economic inequities which continue to kill people on a grand scale, and issues around race and gender which have a direct impact on health and well-being.
There is an urgent need to invest in public health and care services and work together as citizens of one planet to deliver the 2030 Sustainable Development Goals, all of which have implications for our health and well-being.
Following World War II, there was emergence of significant international and national organisations such as the United Nations, UNICEF, World Bank, World Health Organization, and other agencies calling for greater international cooperation.
The science, the evidence and experience from the COVID-19 global pandemic clearly highlight our interconnectedness, the oneness of humankind, and the case for a One Health approach to global health, and the urgent need for evaluation and strengthening of international organizations to serve all people on our planet.
The public health community throughout the world is united and stands ready and eager to support policymakers, individuals and communities in our common endeavor to build a just, healthier future for humankind and the whole planet.
Public health for the future of humanity.
One planet, one people, one health.
Um planeta, único povo, uma única saúde.
Une planète, un peuple, une santé.